You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum. This is Back at It with Dr. Decompression.
Welcome. This is the Back at It with Dr. Decompression. I'm Dr. Dudum. Going to talk about degenerative disc disease, what it is, what are the symptoms, what can you do at home, and do you need spinal decompression? That's what we're going to dive into. Episode 54, this is brought to you by Pillowise and Power Plate. Thank you for our sponsors for providing us the platform. So check this out. We usually talk about disc injuries and herniated, extruded, etc. Now we're going to talk about the disc, but in a different fashion, more of an arthritic condition called degenerative disc disease. So let's break down the disc, right? You've got the outside, which is the annular fibrosis, right? The cartilage, and the inside, which is called the nucleus pulposus. That's the jelly and the flexibility. What can happen is when there's stress in that area, the nucleus can kind of dehydrate. It becomes, when you use that jelly-filled donut analogy, if I have a jelly-filled donut and I leave it out for a week, it's going to be very stale. It's not going to be as soft and pliable and as dynamic. It's going to be more brittle and rigid and stiff. So essentially, that's what it is. The disc, instead of having, to use our model for our viewers, instead of having a big disc like this, it's reduced in size. And then there starts to be stress on the end plates there, and there's degeneration, and it gets squished. Degenerative disc disease, it's wearing out. Symptoms you'll have with degenerative disc disease: just general stiffness or achiness in the lower back. Achiness getting out of bed. Not necessarily sharp pain, but just general stiff and achy. Getting up from a seated position to a standing position, achiness, or just stiffness and rigidity picking something up. So a lot of patients complain about, hey, I can't garden as well because I can't bend down, or I'm picking up my grandkids. And it's not necessarily as sharp pain. It may be, but it's just a general stiff, achy feeling. You may get some referring pain down the legs. It's not as common as, say, a bulging disc, but it's possible that you could get some referring pain down to your legs. So it's not if you have pain on your legs, it's degenerative disc disease, but it's typically a localized, but it may go down your legs if it's severe enough or there's enough of an inflammatory response that's happening. So who has degenerative disc disease? We think of, that's degeneration, arthritis, that's for an older population. That's true, but I mean, typically 30 to 50-year-olds are starting to get that degenerative process. I'm 39. I've shared my story about my disc herniation 5 years ago. I have pretty significant degenerative disc disease only at my L5S1. How does that happen? Why does a 39-year-old have that disease? And why is it only on one area of the spine? Because there's been trauma to that area. So my history is I played basketball since I was 5 years old for 18 years, 20 years, every day, 5 hours a day. Well, that consistent pounding wears on your spine. That can combine with, I was tall for my age, I was always leaning forward, some traumas, things like that. It creates stress in that area. Well, I referenced in episode 1 through 10, I'm at 54 now, so I've lost track, but episode 1 through 10, we talked about Wolff's Law, where when there's a stress to the area, our body's natural reaction is to secure the area and lay down more bone. That's an arthritic process. And if there's stress, the disc is going to wear out. So it could be a trauma, a fall, an accident. It could be repetitive movements over time. So like bending and picking stuff up, rotating, things that hinge back and forth all day, or sitting all day. And then other factors like weight could be an issue where there's more stress on your spine. A lot of people, if they lose 5, 10, 20 pounds, their back feels better because there's less stress on the lower part of their spine. So those are the main three factors. We've got injuries, repetitive stress over many years, and other factors like weight that could contribute to degenerative disc disease. How do we find out about degenerative disc disease? An X-ray is a great way to know. Super easy. An X-ray shows that the disc space, the space between the two bones, the disc is shortened. It's compressed. There's less disc there because the disc is dehydrating and it's reducing in size. You could see it on an MRI. So you can see degenerative disc disease on an MRI. You can, but you don't need an MRI to diagnose degenerative disc disease. Now, that's different than a lot of previous episodes, right, where I've mentioned you need an MRI to diagnose a disc bulge, a disc herniation, or disc extrusion. To see how the soft tissue of the disc has migrated requires an MRI. To see the bone and the arthritic process of a disc, X-ray. So you can diagnose them differently. What do you do if you have degenerative disc disease? Like, where do you start? Well, it's a condition that we want to create movement. It's a degenerative condition. We want movement. Do you need decompression? You just got diagnosed with degenerative disc disease. Do you need spinal decompression? No, don't start with decompression. What can you do at home today if you get diagnosed with degenerative disc disease? Movement is key. Do not sit. Okay. Sitting is going to create more pressure on the disc. It's going to create more arthritic process and stress on that disc. It'll continue to degenerate the disc. Don't sit. So on the opposite of sitting, moving. You got to move. Start walking. Walk a lot. Okay. Multiple times per day. Different things, different stretches work really well for degenerative disc disease. I love these two stretches for degenerative disc disease. I love knee to chest, flexion-based exercises, and you can rock back and forth. And then I love cat-cow or cat-camel, a great exercise to create flexion and extension and movement in the spine to create movement and increase nutrients and blood flow and oxygen, get inflammation down. Cat-cow is a great one. We're not trying to stabilize the spine. Those would probably be good exercise, but we want movement in the spine, okay? Now, I've brought up inversion tables a lot, okay? And I've compared inversion tables and how they are vastly different than a spinal decompression table. So different. Here is a case that I think an inversion table would be excellent. If you have degenerative disc disease and you're trying to get movement in that spine and that disc level, use an inversion table. All you're simply doing is trying to just hang a little bit and pull and get some nutrients and decrease inflammation in that area. Use an inversion table. You don't need a specific angle with a specific weight and a specific oscillation cycle. You're just looking for movement. Get an inversion table. I don't know what the best angle on your inversion table is based on your degenerative disc disease. You have to have a little more information, but it's safe, I believe, to start to see if you feel better. Now, on the opposite, as I've talked many times, if you have a disc bulge or especially a herniation or extrusion that's maybe migrated up cranial or down caudal or to the side or to the center, you should not be hanging and trying to get things open because it could risk it getting worse or a flare-up. So inversion tables with degenerative disc disease, awesome. Inversion table with disc extrusions, not a big fan of. Those are the differences. So yeah, get an inversion table, try it for sure. You can try other things like physical therapy, get some movement-based exercise in there. Chiropractic is great to do manipulations and get movement in the spine to decrease inflammation. It's fantastic. Other things at home, it's an arthritic condition, right? Arthritis, let's break down arthritis. Arth means joint. It's Latin for joint. Itis is what we attach to inflammation. Inflammation of the joint. Arthritis. So you'd want to possibly take some anti-inflammatories. love things like turmeric, ginger, boswellia, omega-3s, quercetin. These are all great things to take that would help reduce your inflammatory response. They may help with your pain. They may help with other inflammatory things going on, other joints. So you've got at-home stretches I recommended. You've got walking, not sitting. Try an inversion table. Try physical therapy. Try chiropractic. Didn't mention this. Acupuncture would be great to get some decrease the inflammation. It's not as much movement based, but it's anti-inflammatory based. All great things to try. Try that. Now, give those things a shot. When I see someone in the decompression clinic and we're having our consult, I ask all these questions. So the process with me is we have a phone consultation. I review a history, symptoms, doctors you've seen, what you've tried, what our goals are, etc., and any imaging. And if you have tried all of those things and you are not getting the results, so say you've tried those things, you're not getting the results you want. You still have achiness getting out of bed, picking up your grandkids is still challenging, and you just feel a general stiff and achy in the back, and you're not happy with where you're at, that's when we would explore a possible decompression program. Very fair to try those other things first. I recommend you try those things first before you see me. So how does decompression work for degenerative disc disease? I discuss on a lot of these episodes, pre and post MRIs, getting the disc herniation to reduce in size, the extrusion to reduce in size. Heck, we even have a research paper, a peer-reviewed research paper published on pre and post MRIs showing the efficacy of decompression on a disc material and reducing the size. Degenerative disc disease is completely different. It's arthritic condition. So my goal with decompression, sorry for the listeners, but for the viewers, now I'm not trying to get that disc back in. There's an inflammatory stress here, which is degenerating the disc, okay? I'm trying to pull and oscillate to change the inflammatory response, get some nutrients into that disc, get some movement from an axial perspective, meaning a long perspective, get blood flow, get nutrients, decrease inflammation, get movement from a different perspective to reduce the symptoms. I'm not going to be taking a MRI 3 months later to show that the disc has magically regenerated. That's not what that is. An MRI 3 months later to show that the disc has reduced in size of an extrusion, yes, I will do that. The goal with degenerative disc disease is to create movement and oscillation and create pressure change just to help reduce the inflammatory response to have someone live better. That's the goal of decompression for degenerative disc disease. It's actually very similar to stenosis, because stenosis, I'm not trying to get the hole bigger because it's arthritic. I'm trying to decrease the inflammation around that nerve to help with symptoms. So it's similar in stenosis, lateral or central stenosis, than it is a disc extrusion or herniation. Same mechanism, but different types of outcomes as far as permanent change. Have a story of Jay. Jay was on the podcast in the 20s. I think he was episode 17. I'm just guessing. And Jay has a degenerative condition. He's got degenerative disc disease, and he can't walk very well. And he gets out of bed and he's in a lot of pain. Met with Jay. After just 3 sessions, he felt amazing. He had tried so many things. He was recommended to get surgery. He didn't want surgery. We did decompression. In just 3 sessions, he felt like he could move easier. His life was easier because we angled and we kind of pulled and we just decreased the stress in the disc because it's inflamed. It's irritated. There's pressure. We're reducing the stress response, and his spine's getting a little bit more movement in a different way than an exercise. then an adjustment, then a PT program, then turmeric, then yoga, just different. He's doing great. And so he needs to come in every now and again because he has a degenerative condition. And that's how it works. Different than someone with a disc herniation or an extrusion. But again, we see a lot of patients that have these degenerative conditions that get amazing results and they're able to get out of bed without pain and garden and pick up their kids or their grandkids, and they can live better lives with less pain. It works very well, but try those other things first. Try yoga, try an inversion table. Increase the turmeric input, increase boswellia. Try those things at home that could be helpful to you to reduce the inflammatory response due to the degenerative disc disease. That's pod 54. Okay, we talked about degenerative disc disease, what it is, the 3 causes of it. So a trauma, repetitive stress over time, and other cofactors like inflammation and overweight or obesity. Okay, those 3 things. What can you do today from listening or watching to this if you're suffering from that? You can do knee to chest stretches. You can do cat-cow exercises. Make sure you don't sit for very long. Keep walking. Try yoga. Try chiropractic care. Try physical therapy. Increase your turmeric, boswellia, quercetin. Increase all those anti-inflammatory compounds. And see if it gets better. See if you can move better, if you're less stiff. If not, then call me and we'll try a decompression program. But try those things first to see if you can get some relief.
It's obvious that you're having lower back pain and you want to get relief. Text me the word relief to 925-291-5670 to download your free low back pain guide. Start fixing your back today and get the relief that you deserve.
I hope this helped. Hope you gained some information on what it is, what you can do, and if you or someone is suffering and you don't know where to start, or you've tried things and you're frustrated, maybe the next step is in this video. So I'm Dr. JD Dudum. I want to thank our sponsors, PillowWise and PowerPlate. This is the Back at It with Dr. Decompression. Don't forget to subscribe for the next video and podcast. Thank you for listening, and we'll see you next time.